Hello, my health enthusiasts. Welcome back to Healthy Healing Habits, where we embark on a journey of wellness. It's your favorite bestie, Amara. How are you all doing? Comment below. Now let's get ready for an informative treat. Please do subscribe, hit that bell, and let's get educated. Today's discussion surrounds polycystic ovarian syndrome. What is it though? Polycystic ovary syndrome, also known as PCOS, is a condition in which the ovaries produce an abnormal amount, imbalance, of androgens, male sex hormones, which are usually present in women in small amounts. In polycystic ovarian syndrome, numerous small cysts, fluid-filled sacs, form in the ovaries. In most cases, there is a decreased amount of follicles, which is naturally produced by either ovary that allow women to ovulate. This decrease results in fertility. Now you may ask, what causes PCOS? Well, my answer to you is simply this. The exact cause of PCOS is unknown, however. Many women with PCOS have insulin resistance, where the body is unable to use insulin well. When insulin levels build up in the body, this may cause higher androgen levels. Obesity can also increase insulin levels and allow PCOS symptoms to worsen. PCOS may be hereditary, as seen in some families, such that it is common for sisters or a mother and daughter to have PCOS. A typical menstrual cycle of a woman occurs as 8 to 12 cycles per year. This usually means a period at least every month. This is not the case for the woman who has polycystic ovary syndrome. Women with PCOS often suffer from a lack of or infrequent period that may not occur for periods of 35 days or longer. Let's take a look into the many signs and symptoms associated with PCOS, some of which can be easily overlooked. Symptoms are usually seen in women during their reproductive years, between ages of 13 and 45 nonetheless. It may present itself at much younger or older ages. These common symptoms include cyst formation on ovaries, irregular periods, no periods, unexplained or uncontrollable acne, weight gain, type 2, diabetes, high cholesterol, high blood pressure, and hair loss, skin tags, excess body hair, including the chest, stomach, and back, hirsutism, dark or thick skin patches on the back of the neck, in the armpits, and under the breasts. Women with PCOS may experience mental health symptoms such as depression, anxiety, and eating disorders. Some of the symptoms of PCOS are like those caused by other health problems, therefore. An ultrasound and complete blood test are performed. An ultrasound, which is used to examine the size of the ovaries and determines if cysts exist and examines the thickness of the lining of the uterus, endometrium. A blood test will examine if there are high levels of androgens and other hormones, as well as high levels of blood glucose, cholesterol, and triglyceride. Let's get into the finer details of this video. As we are accustomed to our daily heavy carbs, fats, oils, dairy diet, we must bear in mind that we must eat clean and healthy for our bodies to function as it should, such that, in the case of PCOS, one must alter their diet to alleviate some of the aforementioned signs and symptoms. One such alteration in one's diet is by adopting to a low glycemic index diet, which focuses on consuming foods that have a minimal impact on blood sugar levels. This can help stabilize insulin levels and reduce insulin resistance, which is common in PCOS. So meals including non-starchy vegetables, legumes, whole grains, nuts, seeds, and most fruits, especially berries, are recommended foods for those with PCOS, while refined carbohydrates, white bread, pasta, sugary snacks, sugary beverages, and processed foods are to be reduced or eliminated from one's diet. Another type of diet to consider is the Mediterranean diet, which involves whole, unprocessed foods, with an emphasis on healthy fats, lean proteins, fruits, and vegetables. It has been associated with improvements in insulin resistance and inflammation, both of which are relevant to PCOS management. Such diet should include cold-pressed olive oil, fatty fish, such as salmon and mackerel, nuts, seeds, fruits, vegetables, whole grains, and minimal consumption of dairy and lean meats. This diet is rich in antioxidants, anti-inflammatory compounds, and omega-3 fatty acids, which may help mitigate PCOS symptoms. Now, an anti-inflammatory diet may be new to some persons, but it is similar to the aforementioned diets. This diet is recommended in cases of chronic inflammation, such as PCOS. This diet focuses on reducing foods that promote inflammation while increasing consumption of foods with anti-inflammatory properties. It is recommended that fatty fish, leafy greens, cruciferous vegetables, such as broccoli and Brussels sprouts, berries, turmeric, ginger, and green tea are consumed within this diet. Please bear in mind, adequate nutrients and minerals should also be a part of this daily diet, as they individually play a key role in PCOS management. Intake of adequate fiber from fruits, vegetables, legumes, and whole grains regulate blood sugar levels and promote satiety, which may aid in weight management. Omega-3. Fatty acids found in fatty fish, flax seeds, chia seeds, walnuts, or capsule form can be consumed due to having anti-inflammatory properties that aid in improving insulin sensitivity. The substance chromium picolinate is involved in carbohydrate metabolism and insulin action. Therefore, it is necessary for a PCOS person's diet. It can be found in broccoli and grape juice. It is said that zinc deficiency has been linked to insulin resistance, therefore, it is vital for this mineral to be included in the diet. Oysters, beef, chicken, lentils, and pumpkin seeds are rich in zinc. Magnesium plays a role in insulin sensitivity and glucose metabolism, and as such, it is also vital to be included in the diet. Good dietary sources include spinach, almonds, avocado, and whole grains. Staying hydrated is essential for overall health and can aid in weight management. Well, there is a concern if one should consume 8 glasses of water a day, yes. While you may not reach this amount daily, do drink as much as you can. Water naturally flushes the waste and other components of the body, therefore, it is vital for everyday use. Note that in any dietary alteration, it is important to consult with a dietitian who will develop personalized dietary plans based on specific goals and medical history. While dietary changes alone may not cure PCOS, they can significantly improve symptoms and overall health when combined with other lifestyle modifications and medical treatments. Aside from dietary change to manage PCOS, herbal remedies may also help in the management of PCOS. While scientific evidence supporting the efficacy of herbal remedies for PCOS is still emerging, some herbs show promise in managing symptoms and improving hormonal balance. Here are several herbal remedies commonly used in PCOS treatment. Cinnamon, Cinnamomum verum. Cinnamon may improve insulin sensitivity and regulate menstrual cycles in women with PCOS by lowering blood sugar levels and reducing insulin resistance, typically taken as a supplement or added to foods and beverages. Note well, people with liver disease or those taking medications that affect liver function should exercise caution when using cinnamon supplements. Spearmint, Mentha spicata. Spearmint tea has been studied for its potential anti-androgenic effects, which may help reduce levels of androgens, male hormones, in women with PCOS, leading to improvements in hirsutism and acne. Drinking 1 to 2 cups per day is common. Chasteberry, Vitex agnus castus. Chasteberry is believed to act on the hypothalamus and pituitary glands, helping to regulate hormone levels and menstrual cycles. It may also reduce levels of prolactin, a hormone that can interfere with ovulation. Typically taken in capsule form, the dosage varies from 150 to 300 mg per day. Note well, chasteberry may interact with certain medications, including hormonal contraceptives and dopamine antagonists. Consultation with a healthcare provider is advised, especially for women taking medications that affect hormone levels. Inositol. Inositol is a type of sugar alcohol, has been studied for its role in improving insulin sensitivity and ovarian function in women with PCOS. It may also help reduce levels of androgens and improve menstrual regularity. Myo-inositol and D-chiroinositol are the two most common forms used in PCOS treatment. They are often taken together in a specific ratio, 41. Dosage varies from 2 to 4 grams per day. Consultation with a healthcare provider is recommended, especially for women with underlying medical conditions. Licorice root. Licorice root contains compounds that may have anti-inflammatory and anti-androgenic effects, potentially helping to reduce symptoms such as hirsutism and acne in women with PCOS. Licorice root is available in various forms, including teas, capsules, and extracts. Dosage varies depending on the form and preparation used. Dog blood plant. Dog blood plant, Ravina humilis, also called bloodberry, is known commonly in the Caribbean to improve fertility issues. Its concoction can also be used to treat period cramps. One would need to consume a cup of tea per day, starting 3 days before the period is due, and this may be combined with the vervain bush, another fertility bush. Herbal remedies can be a valuable addition to PCOS management when used appropriately and under the guidance of a healthcare provider. While they may offer symptom relief for some individuals, they are not a substitute for medical treatment, and their efficacy varies from person to person. In addition to dietary and herbal approaches, supplements and nutraceuticals play a significant role in managing polycystic ovarian syndrome, PCOS. These compounds can address underlying hormonal imbalances, improve insulin sensitivity, and support overall health. N-acetylcysteine, NAC. NAC is a precursor to glutathione, a powerful antioxidant. It may help reduce insulin resistance, lower androgen levels, and improve ovulation in women with PCOS. Typically taken in doses ranging from 600 mg to 1800 mg per day. Vitamin D. Vitamin D deficiency is common in women with PCOS and may exacerbate symptoms such as insulin resistance and irregular menstrual cycles. Supplementing with vitamin D may help improve these symptoms. Dosages vary based on individual vitamin D levels. Dosage ranges from 1,000 to 5,000 IU per day. Probiotics. Probiotics are beneficial bacteria that can support gut health and may help reduce inflammation and improve insulin sensitivity in women with PCOS. Found in fermented foods, such as yogurt, kefir, sauerkraut, and kimchi, and probiotic supplements. Dosages vary depending on the specific probiotic strains and individual needs. Check for supplements containing a variety of lactobacillus and bifidobacterium strains. Supplements and nutraceuticals can be valuable additions to PCOS management when used appropriately and under the guidance of a healthcare provider. While they may offer symptom relief for some individuals, they are not a substitute for medical treatment, and their efficacy varies from person to person. Implementing lifestyle modifications is essential for managing PCOS and improving quality of life. By adopting healthy habits, individuals with PCOS can take control of their health and reduce the impact of symptoms on their daily lives. However, it's important to remember that lifestyle changes may take time to yield noticeable improvements, and consistency is key to long-term success. Consult with a healthcare provider or registered dietitian to develop a personalized plan tailored to your individual needs and goals. Oh yes, that was a mouthful, brainful, and eyeful, but I'm sure it was worth it. Thanks for tuning in to Healthy Healing Habits. Leave your comments below and subscribe for more. See you next time. Stay healthy and happy.